Mental illness is something that affects millions of Americans every year and is on the rise across the globe. In the United States, approximately 1 in 5 adults experience a mental illness in a given year, and youths aged 13 to 18 experience a severe mental illness at some point in their life. So what exactly is mental illness? Mental illness can refer to various disorders and conditions, including depression, schizophrenia, eating disorders, substance abuse, addiction, etc. Mood disorders, including major depression, dysthymic disorder, and bipolar disorder, are the third most common cause of hospitalization in the U.S. for both youth and adults aged 18 to 44. Even though mental illness is something that affects millions of Americans, about 56% of adults suffering from mental illness is not receiving the treatments they need to live a healthy and productive life. Reasons for this include medical costs, lack of access to medical professionals, and not taking advantage of treatment due to the stigma associated with mental illness disorders. Mental health issues are costing the United States billions of dollars in the workplace, and lack of treatment is linked to incarceration. So what can be done about this? Technology may be a key factor to the future of mental health treatment. Mobile devices such as smartphones and tablets provide useful apps that can be used by the public, healthcare providers, and researchers by providing them with ways to access help, monitor progress, and increase mental well-being. For example, mobile apps could use the device's built-in sensors to collect information on a user's typical behavior patterns and provide a signal for the user to get help if it detects unhealthy behavior changes. Apps could also be used to inform users on mental health, provide user connection to medical professionals, improve memory and thinking skills, monitor their health, and more. Some examples of existing mental health apps people might find useful include Talkspace, Optimism, and Spire. Talkspace allows users to connect to over 200 licensed therapists via messaging. Users are matched to a therapist who they can talk to at any time. Optimism is a self-tracking tool used for coping with mental illness like depression, bipolar disorder, anxiety, and PTSD. The app allows users to create customized wellness plans to chart their coping mechanisms and aids in detecting patterns in their mood, and creating ways to identify triggers that affect their mental well-being. Spire is a wearable technology aimed to track mindfulness and activity. It helps the user detect their state of mind, and provides information such as when they are stressed, where it happened, and what the user was doing to cause them stress. Spire can also detect active and sedentary time, count steps the user has taken, and count the calories burned. With the wide range of opportunities provided by apps and wearable technology, there are a plethora of mental health apps out there. That number is growing every year. However, it is important to remember that while mental health apps are a great resource to provide information and communicate with others, it does not replace treatment from a medical professional.